Good morning, Archer nurses. Welcome, welcome. It is Wednesday. Oh my word, I'm so excited. We are almost halfway through the week. So, my name is Jennifer Bonner. I'm the manager of nursing services here at Archer Review, and I am so excited to have you joining me. This is one of my absolute favorite webinars to present as we go through Guess the Medication. Now, if this is your first time joining us, basically what we're going to do is I'm going to give you a clue and I'm going to have you tell me what that medication is that we're talking about. So, I hope this will be helpful for you. I hope this will be fruitful for you and that will make you want to see more. Now, I have to tell you, I have a couple things that I want to share with you today. So, it's really exciting just to be able to kind of go through this information, talk about other ways that we can be of help to you. Now, before we dive in, if you have never met me, so I explained I'm the manager of nursing services. So a lot of what I do is private tutoring, webinars, small groups, that type of thing. But one of my favorite things to do is to explain about how we as nurse educators were once in your shoes. And so a lot of times what we hear is students saying, you don't understand, and you are in a very unique position as a student. I know things are a lot different than when I was in nursing school. So when I graduated nursing school it was over 16 years ago, I jumped right into an ICU. It was the first job that came available. I was kind of like, whoever can hire me, right? Ended up absolutely loving it. I went back to grad school. I needed something a little different. So I went to endoscopy. So I was working in 9 to 5. I did do some call, but for the most part, no weekends, no holidays other than call. And then I realized during my time of working on my FNP that I really loved women's health. So after I finished my FNP, I went back to school to become a certified nurse midwife to specialize in women's health. And then I finished my doctorate shortly thereafter. So I remember what it was like to be a student, but I also remember what it was like to not feel supported. And so here at Archer, that is our goal, is that you do not feel like you are not supported. So we want to give you the tips, the tricks. We want to give you the tools in your tool belt to be successful, not only in nursing school, not only on your NCLEX, but also in your career as a nurse. So along those lines, let's go ahead and check out Archer this week. So what we're going to do is we're going to come over here to NCLEX RN, and we are going to scroll down to see what webinars we have going on this week. I'm going to scroll down just a little bit. You see over here on the left, you can get our 2-hour NCLEX review with Rachel. It is a recording. It is available for $35 and it's good for 1 month. If that's something that you are needing, that is an excellent value. Next week on the 19th, we are going to be talking about conquering nerves. So we're going to be talking about testing anxiety. And then you see that we have the pharmacology crash course starting on Monday. And then we have NCLEX processing for any of you that are international nurses that are wanting to take the NCLEX. Lance will give you the download on NCLEX processing. And then we're going to talk about turning setbacks into comebacks on the 22nd. And this is for when we see those setbacks, when maybe we have an unsuccessful attempt and we're going to try again, what that looks like. So you won't want to miss those opportunities. Now, the next thing I want to check out is, hey, what kind of tutoring options that we have? So we have a couple different options. We have private tutoring and we have small group offerings. So private tutoring, we have both 30-minute and 60-minute sessions. Our 30-minute sessions are $40 and our 60-minute sessions are $75. And those are completely individualized. You can show up and say, hey, Jennifer, I have no earthly idea what I'm doing. Can you help me? And the answer is absolutely yes. Or you can show up and say, Jennifer, I'm really struggling in mental health. Can you help me? And the answer, absolutely yes. So you wanted to check those out. We also have some small groups available. We have one actually starting in about 30 minutes with Tiffany Paolino on EKGs today. Tomorrow on the 15th We have a private tutoring session with Emma, and we also have fundamentals with Megan. So if you're someone that struggles with those foundational, maybe you just got into nursing school, this would be really great for you with Megan. That's tomorrow. And those small group offerings are $25 each, which is a great value. You also get these slides for those. And then looks like Friday is booked. And then Saturday, Megan has a private tutoring session available in the morning if that's something you're interested. So don't forget to head on over to the website, kind of check out what's going on there because there's a lot of great offerings that we have this week. So, without further ado, let's go ahead and jump in. And I'm curious to know, where are you joining us from? And I have a few people asking, is this recorded? It absolutely is. It'll be available on both our Facebook page and also our YouTube channel. So if you are joining us on either Facebook or YouTube, you could go ahead and answer there right in the comment section. Or if you're joining me on Zoom, you can answer right there in the chat. I'm saying Houston, Canada, Maryland. And just a few housekeeping things for those of you joining me on Zoom. If you have a response, so I'm asking a question, you're responding to me, you can go ahead and put that into the webinar chat. If you have a question that you need answered, that's what I want you to use the Q&A for. So we want to try to leave that available for those questions that need answered. All right, Philippines, Canada, Michigan, Kentucky, Texas, Trinidad, South Carolina, Vermont, New York, Arizona, Australia. Someone is asking, how do you find us on YouTube? You can just search Archer Review and it should pop up for you. Great question. Massachusetts, New Hampshire, Maryland. Wonderful. Awesome. Georgia, Nepal, Mexico, Ghana, Australia. Fabulous. Welcome. I'm so excited to see so many of you joining us. Now, a lot of times we feel like we're on an island, and I want you to notice all of the areas of the world that I just mentioned because we are nurses all over the world, from the Philippines to the US to Canada, all of those areas, even Australia, Saudi Arabia, I just saw pop up. So together we are going together. We are supporting each other. And so if you have not found a community of support, please check out our YouTube channel, our Facebook page. We're also on TikTok and Instagram, and we post throughout the week there as well, just kind of helpful tips and tricks. All right. Well, let's go ahead and get started. Let's go ahead and jump into today. We're going to be talking about the endocrine system. So you can imagine the type of medications that we're going to be chatting about just by knowing what system we are going to focus on, right? So here is our first question, and I want you to leave your answers in the webinar chat. So you'll see two boxes on your screen. One, if you're joining me on Zoom, one is going to say webinar chat, and one is going to say Q&A. I want you to use the webinar chat for your answers here. All right, here's our first one. This is a hormone created by your pancreas that controls the amount of glucose in our bloodstream at any given moment. It helps to store glucose in our liver, fat, and muscles. Without this hormone, we cannot store glucose in our muscles or liver, and we can't make fat. Instead, without this hormone, the fat breaks down ketone bodies and causes our blood pH to drop to dangerous levels, leading to DKA. What medication am I? Many of you are like, Jennifer, really? This one's too easy. Someone is asking about a continued education certificate. So unless we have an offering for CEs, we do not offer continuing education certificates. Now, if you join our 3-day live, you can get a participation certificate as long as you're joining all of those sessions. We can email that to you. Great question. Okay, many of you are saying, Jennifer, really? It is, drum roll, please. Insulin, you got it. Insulin. So that's a peptide hormone produced by the beta cells of the pancreas, right? And it plays that central role in regulating our blood glucose levels, right? It's going to help our cells, particularly in the muscle, fat, the liver to absorb that glucose from the bloodstream and either use it for energy or store it as glycogen, right? It also promotes fat and protein synthesis. It's inhibiting the breakdown of that stored energy source. And that is going to be helpful for our bodies. Very good. Many of you got that one. Excellent, excellent job. Now, I got to tell you something we mentioned earlier is that we have a pharmacology crash course. This is a 10-hour course. It is available live. And so our live course is going to occur January 19th through the 23rd from 7 p.m. to 9 p.m. Central Time. And it's going to be with the amazing Lauren Forth. Y'all, she is fabulous. She's great at what she does. She has the tips, she has the tricks, she has the ways to remember things. She is breaking it down in a way that's understandable. You are able to interact with her through the chat and the Q&A. It is a $75 purchase, and you can use your smart device. Whoops. Go ahead and scan that QR code there on your screen, and it will lead you right there. Now, if you cannot attend, there is also the recording that is available to you. It will pop up um in your dashboard. And someone saying Lauren's the best instructor. She does an amazing job. She is a wealth of information. We joke with her that she should have been a pharmacist, but she is an absolutely amazing nurse. So I want you to go ahead, check out that offering. There is also where you can purchase the recording if you can't attend and you need it now. So make sure you go ahead, check that out and see what all the hype is over. All right, well, let's head on back to our next medication. This type of insulin, so we talked about the last one being insulin. This is a type of insulin that's the only type that can be given via IV push or IV infusion. What medication am I? Ooh, I'm seeing, and please go ahead and leave your answers in the webinar chat for us. Okay. Ooh, I'm seeing some back and forth. I'm seeing some regular. I'm seeing some NPH. Okay, several of you are very confident in your answers. I'm impressed. All right. Are you ready for the answer? Many of you are like, I don't need to see it. I know it. It's regular insulin. Now, this is a short acting form of that synthetic insulin that's used to manage blood glucose levels in our clients that have diabetes mellitus. So it's going to start working about 30 minutes after the injection, and peaks within 2 to 4 hours, typically last 5 to 8. Now, regular insulin is going to help lower that blood glucose by facilitating that cellular uptake of glucose and suppressing that hepatic glucose production. Um, the only one that we can give IV push, right? That's the only one that we're going to give through the IV um, or even IV infusion. Okay. Now, we can give this sub Q, totally fine, but it is the only one. That's definitely something I need you to know that we're going to give IV. Excellent job. Well done. All right, next one. Here we go. This medication works by lowering levels of glucose in the blood. It's a fast acting insulin that starts to work about 15 minutes after injection and peaks in an hour. What medication am I? All right, many of you are getting this one. Amazing, amazing. Well done. Many of you got this one. So our answer here is Lispro. Absolutely. Nice work. So Lispro is a rapid acting insulin. It's used to control postprandial blood glucose levels with our clients with diabetes. Very fast onset, um, lasts about 3 to 5 hours. It's designed to be taken immediately before or shortly after those meals to closely mimic that normal physiologic insulin release. So that is definitely something that's important to know as well. Great job. All right. So this medication is used to treat diabetes mellitus. This is categorized as an intermediate type of medication and has an onset of 1 to 3 hours with a peak of 4 to 8. It's given sub Q. So remember on the NCLEX, they will ask you those generic medications. They will give you those options. So someone is asking, can we get the slides for this? We unfortunately do not offer the slides, but you do have the recording available to you on both Facebook and YouTube. Great questions. You guys are absolutely amazing when it comes to the endocrine system. This is so wonderful. Well done. Yes, you are right. The answer here is NPH. So NPH is an insulin that is intermediate acting, used to help maintain that basal blood glucose control in our clients with diabetes, right? So, here in just a moment, we're going to talk about how these are categorized, their peaks, all of those things, because I absolutely want you to understand this medication is typically administered sub Q. And a lot of times we use this with other insulins like rapid or short acting to provide that whole body. And if you have a question, please go ahead and leave it in the Q&A for me. That's where I can find those. And remember, if you are still struggling with pharmacology, maybe it's not endocrine, but maybe it's mental health or it's OB, please go ahead, find our crash course. It is amazing offering. You won't want to miss it. It is absolutely fabulous. All right, so let's go ahead and check out our next one. So, this medication is a man made form of the hormone insulin that works by lowering levels of glucose in the blood. Okay, this specific type of insulin is a long acting form that starts to work several hours after injection and keeps working evenly for 24 hours. It can be used for type 1 or type 2 diabetes. So, we're going to talk about how to prepare NPH here in just a few minutes. That's a great question. And we're going to talk about those peak medications here in just a moment, too. And we'll kind of talk about how to remember those. All right. If you said Glargine, you are absolutely correct. Now, let's go ahead and look at these various different medications. I love a good chart, y'all. I think it just breaks it down a little bit easier. I am a visual learner, but I also need to be doing things with my hands. So if you're a visual learner, this one's great. So, a lot of times what I will do is I might even go ahead and create this in a blank form, maybe just put the rapid acting, or something else that you can do is if you are responsible for someone or you're needing to spend time with someone, this is a great way to make this a game. So you can create this type of a table and you can make flashcards or put little index cards in. I like to cut them in half. And then on one side, I'd put rapid acting, short acting, intermediate, and long acting. Okay. And then I'm going to set up this table on a piece of paper or whatever works. And then I'm going to see if I can put these where they go. So then I'll have another thing that says Aspart, Lispro, regular, and pH glargine, and see if I can put that in the right category. Regular goes with short acting, and pH is intermediate acting, and so on and so forth. Now, I have to tell you something that I found in 2020, when everybody was at home and glass walls became a thing. So we actually have a kind of a glass wall in our home. And we had a time when one of the family members was in quarantine. And so the my kiddos would come home and they would need to work on spelling. So something that we would do is we'd go ahead and get out a expo marker and we would write on the glass windows. So that's a great thing that you can do with these is if you have a glass door or a window, you can write these out. Even a mirror would work too, and then they just erase. So our rapid acting, we have Aspart and Lispro. Now, depending on which one you're using, the peak is a little bit different. So our onset is very quick, so 15 minutes. Our peak for Aspart is 1 to 3 hours versus 30 minutes to 90 minutes for our Lispro. And our um, Lispro is going to last 5 hours, Aspart 3 to 5. So if you're struggling to memorize these or understand where they go, this is a really good way to kind of organize that information. Okay. So depending on our client situation, this may be a doctor's call or is going to be a doctor's call on what medication they're going to order and for which disease process. Okay. If you're someone that is struggling with medications, I would recommend reaching out to a private tutor, going to the pharmacology crash course to see if that can help solidify that information. But a few of you are asking, how do I know if I'm ready to take the NCLEX? So if you're getting 4 to 5 highs or very highs in a row on your readiness assessments, you've gotten at least 80% of the way through your Q bank, that's a cue that, hey, go take your test. Now, don't forget, we also have the Q Bank booster that you can purchase. And we also have a new exit exam if that's something you're looking for. It's just kind of a last ditch. Hey, how's it going? Are you ready to go? It's meant to be taken within the last week to 2 weeks before you take your exam. Okay. Someone is asking about SurePass. So we do have live events throughout the week. We have our live lectures on Mondays. We have live case studies on Wednesdays. And then we have unfolding case studies on Fridays that are available to you. And you can find all of those in your live offering section of your dashboard. Okay. Someone's asking, what does the NCLEX live review consist of and what does the SurePass consist of? SurePass gives you access to our videos, our Q Bank, and also the 3-day live. The 3-day live is a live event that is going through the most high yield information, and it is designed to be taken, whatever that offering is before you take your NCLEX, just as a last minute review and to kind of see where those sticky points are. Good question. All right. So you see our short acting, that's our regular, that is our medication that we can give IV. Onset 30 minutes, going to peak within 2 to 4 hours, and our duration is 5 to 12. Now, you can read all of these medications, but if I am concerned about someone going hypoglycemic, when it comes to the short acting insulin, when would I want to check on their blood sugar? If I'm concerned that it's going to drop them too low after I've given it, when would I want to check their blood sugar? Yeah, within this peak window, right? So if I know that's the peak time of when it's working, that would be my main concern. Now, we also want to teach our clients that are diabetic how to store their insulin. So we want to make sure that it's kept out of direct sunlight. So if you have a windowsill in your home or they do, you want to make sure that we keep it away from there. We don't want it to freeze. So anything like my refrigerator, the other day I went to make some chicken alfredo, I believe it was, and I pulled out my heavy whipping cream and it was frozen. It was in the way back of my refrigerator, just really crazy. So we want them to be sure that they know kind of where those areas in their refrigerator are. I'm sorry, it was in the back of my refrigerator, not my freezer, to avoid this complication as well. Okay, we want them to go ahead and store that until they're ready to use, and then they can keep it at room temperature. So it's also important that they know how long are these insulins good for, and they can write it on the bottle, just like we do in the hospital setting. Our NPH is good for a month, glargine 28 days, rapid and short acting good for 28 days. Okay. Now, what about mixing? What if we need to mix that insulin? So, this is how I remember. I remember RN. I'm going to drop my regular first and then my NPH. Now, there's a few other steps that we need to be considering here, right? So, we know that these bottles of insulin have a vacuum. So, whatever we're taking out, we need to put in. So, what I'm going to do is let's say I need, let me get out my pen here. I need, we're just going to make up some numbers. I need two, whoops, of regular, and I need two of NPH. Okay. So what I'm going to do is I'm going to draw up in my insulin syringe. Is very important. We're using the insulin syringe. I'm going to draw up 4 units. I'm going to insert 2 units of air into my NPH and then 2 units of air into my regular. And then I'm going to draw up my regular and then I'm going to draw up my NPH. Okay. We're going to draw up clear and then cloudy. We're never mixing our long acting insulins. Okay. So we need to drop regular and then our NPH. So remember RN. And then when it comes to administration, there's a few things we need to know about. We need to know that in regular insulin is the only one we're giving IV. Everything else is sub Q. We want to make sure we're rotating those sites. Why? Well, if our client is always administering insulin in the same spot, we can get that skin thickening that eventually can lead to the fact that our insulin is not going to be absorbed as well. So that could be a problem. And we want to make sure they're using that insulin syringe. Remember, units are very different than mils. So it's very important we're using the correct syringe. And then we want to make sure that our insulin is indeed still good. Now, we know how to give these insulins. So where can we give them? Let me know in the webinar chat, where are our options for administration here? Okay, abdomen. So around the belly button, back of the arms, the thighs, yeah, even the buttocks. Absolutely. So it is important that we understand where we can administer these and that our clients understand that as well. Now, listen, I have never given one in the back or the buttocks area. The main ones that I have used are the back of the arms, the abdomen, um, and I really haven't used the upper thighs much, but there are clients that do prefer those areas. So it's important that they understand where those areas are and how to administer. So, one more time for you, there's that pharmacology crash course starts on Monday. If you are interested in joining us, it is going to be an amazing time. And the last thing I want to leave you with is that here at Archer Review, we are here to support you every step of the way. Whether you have just decided that you are going to go to nursing school or you're in the thick of it, maybe you're getting ready to sit for your NCLEX, RN or PN, or maybe you have that behind you and you are headed into the NP space. We have a spot for you. We're here to support you along the way. Thank you for being a part of the Archer community. We love working alongside with you and we love cheering you on. Now, one more question before we go. Someone is asking if I renew my SurePass combo, do I get a 3-day live lecture again? It does not come with the renewal, but you can, I believe it's $75 to attend again if you would like to. But remember, you also get that recording as well in your on demands. Okay, very good. Thank you guys for joining me. Thank you for your attention and your persistence through this information. I'm incredibly impressed with your knowledge when it comes to pharmacology, and I can't wait to see you back next Monday for our next webinar. Take care, everyone. Have a great week.